I'm Gabby Karatka, a 7th semester nursing student. Today's date is September 22nd. It's almost 12 o'clock in the afternoon, and I'm going to be going ahead and showing how to insert an NG tube. So prior to entering my room, I've already gathered my supplies here. I've also checked if there's an order. I've checked my client's history of any nasal surgeries, as well as if they have any deviated septums. I'm also going to check their condition and how they're going to tolerate this as far as their mental status goes, and my client seems appropriate to the situation, so I'm going to go ahead and go in my room. Hand hygiene and provide for privacy. Good morning, Mr. Smith. I'm Gabby. I'm your nurse today. So we're going to go ahead and insert that NG tube down your nose to help clear out that stomach area, okay? Can you give me your name and date of birth? Awesome. Okay, so I'm going to position you into a high phallus position. Raise the bed up just a little bit here. The first thing I'm going to go ahead and do is just inspect his nose before I get started, just to see which nostril is going to be better to enter that NG tube. Okay, so Mr. Smith, can you go ahead and breathe out? Okay, breathe out one more time. Great. I've checked his passageway. It looks like he doesn't have any deviated septums, and I'm going to go ahead and go on the right side here that I'm standing on. So, I'm going to go ahead and perform hand hygiene one more time. We're going to go ahead and get set up here. So I'm going to place a towel over them just in case any secretions get loose. I'm also going to give him an emesis basin in case he feels like he needs to spit or if he gags. Also providing a cup of water in between. You can take a couple sips for me. So Mr. Smith, before we get started, if you feel like it's uncomfortable or hurts at any point, just go ahead and raise an arm for me to let me know, and then I can stop and give you a break for a second, and we'll try to keep going if we can, or if we can't, we'll restart. So I'm going to go ahead and start here. I'm going to get my tube set up. I've got my pieces of tape out here, so the first thing I'm going to go ahead and do is just measure from the tip of their nose to the ear down to the base of the xiphoid process to see how long I need to make this. See how far down it's going. Okay, so it looks like we're going to go to 45. So I'll keep my finger there until I mark it with my tape, just so I know how far down I'm going. Next thing I'm going to go ahead and do is get my lubricant ready, because now that I have it taped off, I know where I'm going. I'm going to place some lubricant on my towel and lubricate it. Alright, Mr. Smith, we're going to go ahead and get this inserted. So I'm going to take it in my right hand, my dominant hand, kind of wrap it around, and we're going to go ahead and hyperextend your neck to go down. 1, 2, and 3. I'm just going to kind of make this a swift process. Once I see that he's kind of starting to choke, I'm going to go ahead and stop for a second. If he wants a sip of water, I'll give him a sip of water. Go ahead and continue. And now that it's down in the oral cavity that I can see it, we're going to go ahead and put his neck down and go ahead and insert it all the way till I get to that 45 mark. Okay, now that we're here, we can go ahead and secure it to his gown. Perfect. Now before completely securing it, we want to do our checks. So according to my policy, we do a chest x-ray to confirm placement. We can also do a pH strip test, which I'd go ahead and aspirate some of those stomach contents up and use a pH strip to make sure that it's within the normal range. Or we can also do an air whooshing into the tubing and listen for it to not be in his lungs, around his lungs. So I do those 3 checks just to make sure. And then we can go ahead and tape it down now that we know it's in the correct placement. We got that chest x-ray back. And I used little tabs on here so then it is easy to take off and be replaced. We'll just go right around the tube and up to the base of his neck, or the base of his nose. And I can also go ahead and replace this with a safety pin once I'm done. So I'm going to go ahead and document, and I also have this capped off right now because we're not actively using it. If we were using it, I'd either hook it up to suction or give meds or anything. I can uncap it. As far as documenting go, I'd see how they tolerate it, how far down I placed it, and then that chest x-ray or pH strip or anything to confirm that it was in the right placement. I'll go ahead and just clean out my supplies, and I can put them back down into comfortable position. And I'll perform hand hygiene.